This lesson is going to cover a few other points about cancer and cancer treatment that you need to know to care for and educate your patients. Now, oncology is considered a specialty, so we won't go into too much detail, but we're going to hit the highlights. First, we want you guys to learn this mnemonic about the warning signs of cancer. So the mnemonic is the word caution. C, change in bowel pattern. If you are regular and you suddenly start seeing diarrhea or even constipation, or especially blood in the stool, that's indication of a problem. A sore that doesn't heal. U, unusual bleeding or bruising. We talked about that in leukemia, because those patients can experience thrombocytopenia. T, thickening of breast, testicle, or skin. So any kind of lumps, bumps, or masses we want to be aware of. I stands for indigestion, especially if it's persistent. Now, of course, we want to rule out any kind of cardiac source first, but that is something that could be a warning sign. O stands for obvious change in mole. Now, in the skin cancer lesson, we're going to talk in more detail about how to determine if a mole might be malignant. And then finally, N stands for a nagging cough. Now, any kind of persistent symptoms, so persistent fatigue, persistent cough, persistent indigestion, they all indicate that something could be wrong. So we want to encourage our patients to trust their instincts when something like that happens. Now, as far as diagnosis, an official diagnosis can only be made with a biopsy or a histologic exam. That's when we look at the cells under the microscope and we look for the actual abnormal growth or the abnormal cells. Once we've confirmed that it is malignant, we stage it based on the extent of the spread of those malignant cells, otherwise known as metastasis. So if it stays in one place and it's not growing at all, it's a stage 0. If it's spreading and growing, it's a stage 1. And down and down and down, the more it spreads, the more it grows, the higher the stage. So a stage 4 is when it has spread to other organs and has started to affect those organ systems as well. Of course, the higher the stage, the more severe the diagnosis and the poorer the prognosis. Now, we just want to review some key points of common cancers found in females and males. Now, a key point here is that men can also get breast cancer. They still have breast tissue, they just have less of it. So keep that in mind. Do not isolate breast cancer to only females, although that is where it is more common. Now, breast cancer, it has a high risk of metastasizing because of its proximity to the lymph system. You've got a patient's underarm lymph system right in here in their axilla. And so that's very close to the breast tissue that's here. And it's very common to have metastasis. Risks for breast cancer, early menarche. So that's when they start their menses early in life, or late menopause. Basically, the more exposure they have to estrogen, the more likely they are to get breast cancer. So we want to educate and encourage our patients to do breast self-exams. They should be done monthly. And the most common or the best time to do it is 7 to 10 days after their menses. That's when they're most likely to find the lump. Now, if a patient has had a mastectomy or lymph node removal, we want to put a limb alert on that arm, on that side. So no blood pressure, no IV sticks, because it puts them at high risk for lymphedema. Now, as far as cervical cancer, the best way to detect cervical cancer is with a pap smear, with regular pap smears. Now, current recommendations are to get one every 3 years unless you've had abnormal findings, in which case it should be annually. A lot of advocates for cervical cancer have called it a silent killer because sometimes it's asymptomatic until it hits those advanced stages. So sometimes the symptoms can be mistaken for just bad period cramps. So we advocate for pap smears. We want to make sure we're not missing anything. As far as men, the most common cancers are testicular and prostate cancer that affect specifically males. Testicular cancer is the most common cancer in males age 15 to 35, and it's usually found because of a lump or a mass felt on the testicles. That's how they find it. So it's important that these patients are doing monthly testicular self-exams. And the best time to do that is right after a warm shower when there's vasodilation and everything's kind of open and warm. As far as prostate cancer, it's actually the most common in men that are over 50. These men should be getting regular annual prostate exams every single year after the age of 50. If necessary, and especially if it's localized, the prostate can actually be removed with a TURP procedure. TURP stands for transurethral resection of the prostate. We talked about that a lot in the benign prostatic hyperplasia lesson within the GIGU course. So definitely check that out if you want to learn more about that. Now, finally, we just want you to be aware of some precautions with cancer treatments. Now, chemotherapy does require specialty training to administer, so you don't need to know those details. Just know that it's considered a biohazardous chemical and it has to be handled and disposed of carefully. Now, remember that chemotherapy works by killing all of the fast-growing, fast-multiplying cells like cancer cells, but that includes healthy, fast-growing cells like hair and mucous membranes. So we want to consider that patients are going to have a lot of symptoms as far as that goes. It can also cause damage to nerves, or there's like local reactions wherever we inject the chemo. Now, the other big issue is that it tends to decrease the immune system. So the patient is going to be at higher risk for infection, and they're going to have decreases in all of their blood cells. Remember, when we have a decrease in everything, and this bone marrow suppression is called aplastic anemia. They stop making all of their blood cells. So they're neutropenic, they're anemic, and they're thrombocytopenic. So altogether, we call this pancytopenia. Remember, penia means a lack of, cyto means cell, and pan means all of them. Okay? So a lack of all of the cells is neutropenia, anemia, thrombocytopenia. Now, the big thing you need to know about radiation specifically is it can cause radiation burns. So we want to make sure we keep their skin hydrated, keep it soothed with aloe or lotion, and we do really good, thorough skin assessments. So just to recap some of these important points, we use the mnemonic caution to remember the warning signs of cancer, encourage patients, if something doesn't seem right, say something to your provider. Now, we're going to use a biopsy or a histologic scan under a microscope to officially diagnose cancer, and then we'll stage them based on the extent of their spread or metastasis. We want to encourage patients to get regular pap smears or prostate exams and to do monthly breast or testicular self-exams so that these common cancers can be detected early. And when patients are in treatment, we need to make sure we manage their symptoms. A lot of patients actually find that the treatment is more difficult than the cancer itself. So we want to support them through this. Okay, so those are some of the important points about oncology and cancer. Let us know if you have any questions. Now go out and be your best selves today. And as always, happy nursing.